Hello, today we are going to discuss knee arthritis. In our language, we call it osteoarthritis of knee. We'll discuss about causes. What are the causes of osteoarthritis or arthritis of knee? Osteoarthritis of knee is generally caused by number one, degeneration of the joint with aging. With aging, there is a small part of the joint which is called cartilage and ligament and meniscus and synovium. They get degenerated slowly over a period of time. As aging process goes on, all these structures start becoming stiff and there is something called as synovitis or inflammation. Slowly, as the progression of synovitis and inflammation happens, joints become swollen and there is slow destruction of the cartilage. Over a period of time, this leads to deformity of the joint, restriction of range of motion, pain and swelling. Basically, this is the common cause of arthritis of knee. Other causes are rheumatoid arthritis, which is due to autoimmune disease called rheumatoid arthritis. It causes slow, progressive degeneration of the joint due to the inflammatory process. Other causes include any injury and fracture of the knee joint, which leads to malalignment of the knee and leading to osteoarthritis of the knee. There are some minor causes, but these are the main three causes of osteoarthritis. What are the symptoms of osteoarthritis of knee? Osteoarthritis of knee is characterized by number one, pain on movement, number two, swelling, number three, redness and difficulty in moving the joint. Restriction of range of motion is very common with progression of the disease, and last but not the least is development of deformity. Now, how do you avoid osteoarthritis of knee? You can avoid osteoarthritis of knee by one, keeping your weight under control, keeping bones strong, regular exercise, taking supplements such as calcium and vitamin, doing regular physiotherapy if already arthritis has set in. There are supplements such as cartilage supplements, anti-inflammatory medicines which help in reducing inflammation and reducing swelling. In advanced stages like grade 2 and 3, you can give stem cell therapy, GFC therapy and other regenerative medicines can be given. In advanced stages where there is a grade 4 arthritis, the only treatment available is knee replacement. Knee replacement can be divided into partial knee replacement, total knee replacement, or you can change even a segment of the knee. So osteoarthritis is a very common disease and it needs thorough treatment by a professional. Thank you.